What if I told you there's a strategy you could implement into your educational endeavors that can help learners engage in a deeper learning process and adopt more of a growth mindset? Sounds intriguing, right? Hi, I'm Amy Gardner, Associate Dean for Faculty Development here at the University of Colorado School of Medicine. Hear from Dr. Gail Armstrong, Professor of Nursing and President's Teaching Scholar here on the Anschutz Medical Campus, on how she has integrated reflective practice into her teaching for the past 20 years and the beneficial outcomes she's seen among her learners.
What does the term reflective practice mean to you? Many people think reflection is some sort of solitary meditative process. We all reflect. We look back on experiences with inquiry and curiosity. But this is not reflective practice. Reflective practice is so much more. It's a deeper, more conscious learning process that has a more significant impact on learning and behavior change. And I'm excited to tell you about how reflective practice can transform your practice as an educator. I'm Gail Armstrong, professor in the College of Nursing at the University of Colorado Anschutz Medical Campus. I've been using reflective practice in my own teaching for more than 20 years, and I'm thrilled to share with you how it has become one of the most potent tools in teaching my learners how to be self-aware, critical thinkers, excellent communicators, and happy in their practice. But first, what is reflective practice and how does it work? In contrast to general reflection, reflective practice is a challenging and often demanding process that allows our learners to develop a greater level of self-awareness about the nature and impact of their experiences and performance. As you know, awareness is essential to behavior change. It's the development of this new awareness that then allows for the creation of genuine opportunities for growth and development. Donald Schoen, the author of The Reflective Practitioner, coined the phrase double loop learning. Single loop learning is the common reflective process that all humans engage in to some extent. It is a fix-it model. A solution is developed to correct a presenting problem. But in this single loop learning experience, the underlying causes or discrepancies with one's ideal state or values are neither recognized nor addressed. Instead, reflective practice involves double loop learning, which holds the potential for learner growth and development. Reflective practice examines one's underlying assumptions and looks at a learner's guiding values as part of the reflection process. Achieving this conscious awareness, however, requires guidance and practice. Let me share an example with you. Imagine one of your learners had a troublesome event or experience, some sort of unsettling experience that cannot be resolved by looking at the surface details. Perhaps, for example, they make a comment to a patient that appears to reflect some sort of bias or stereotype. This comment is overheard by another healthcare provider who then approaches them about the comment. A learner in that situation might just as easily dismiss the whole situation as a slight slip of the tongue. They might ruminate in their personal frustration with themselves, or even get angry at the other provider who called them out. A learner who is taught to engage in reflective practice, however, would be driven by the feelings of uncertainty or unease. They would step back to examine the experience. What happened in this situation? What were my intentions? What did I do? How did the feedback impact how I understood the situation? And in the process of observing and analyzing this experience, incongruities inevitably emerge. Discrepancies between real and ideal, between intention and action, or between action and effects. The discomfort stemming from these discrepancies can lead to greater self-awareness, exposing underlying contradictions in one's belief system. This awareness can lead to a desire to change. With further inquiry, the learner learns to absorb new information as part of an active, endless process of self-discovery and a desire to have one's behavior be in alignment with one's values. Now, motivated by awareness of the problem, the learner can begin to be aware of common situations that prompt these incongruities. The learner can grow in self-awareness and learn to accept feedback without becoming defensive. Over time, when reflective practice is used iteratively, learners often adopt a growth mindset. So in short, by integrating a process by which learners can raise questions about their actions or performance, they can begin a learning process that leads to behavioral change. But how do we begin this process of promoting critical reflection and awareness among our learners? To integrate reflective practice into your educational endeavors, follow these 4 tips. Become aware of the evidence in the medical literature. There's abundant evidence describing how reflective practice can be integrated into learning at various phases of development. Create time and space for learners to engage in reflection of their experiences. Invite learners to consider an experience in relation to one's professional values. In the educational setting, reflective practice usually includes reflecting the learner back to themselves. Incorporate exercises that encourage crystallization of the double loop learning process. This can be done through written reflections, simulation exercises, or walking through case-based examples. And be sure to model the practice you are intending to be adopted by your learners. Share concrete experiences where you encountered a problem, engaged in reflective practice, and share the insights that you gained. Individuals who regularly engage in reflective practice stay closer to their values, are happier in their practice, and are at lower risk of burnout. I encourage each of you to consider how you can build the reflective practice foundation in your teaching and practice now.